Bismillahirrahmanirrahim. Assalamu alaikum. Today we will discuss a very important case of swelling over side of neck. Your command will be examine the neck and do the related examination. Our second command can be the do the general physical examination. When you see such a swelling, you think about the three differential diagnoses. Either it will be tuberculosis, lymphoma, or infectious mononucleosis. First of all, introduce yourself, then take informed consent. Then warm your hand if outside is cold. Make position of the child. Ideal position would be sitting and patient should be undressed only with panties. Then do inspection. Take a 10 second to observe the child. His general build, toxic or normal look, take respiratory rate and have a look over swelling. Now approach to the patient in gentle manner. Ask for pain over swelling area to patient. Then take size in two dimension. Is it single or multiple? One sided or two sided? Movable or fixed? Matted or solitary? Puckering is present or not? Any discharging sign? Any sign of inflammation like color, dolor, rubor, tremor, and loss of functionalisia. Also have a look for any engorgement of the veins. Check adjacent area on the both side of the neck. Must examine all group of lymph nodes like submandibular, submental, pre and post auricular, occipital, axillary, and inguinal. Also check the consistency of the lymph node. Either they are discrete, rubbery, nodular, tender, unilateral, or bilateral. On the basis of lymph node, how we can differentiate the all three differential diagnoses. Like in tuberculosis, lymph node can be matted, adherent to overlying or underlying skin. Sinus can be present or not. Lymph node are mostly hard, can be tender if any active sign of inflammation is going on. They having the nodular feel. While in case of lymphoma, they are rubbery in nature, non-tender, no skin changes. They mostly are having multiple areas involvement, and the patient is also non-toxic. While in case of infectious mononucleosis, the lymph nodes are discrete, tender, unilateral, splenomegaly can be present. In most of the cases, the patient is febrile, toxic, having the oral finding of the oral ulcer and pharyngitis. Then start general physical examination by doing the height, weight, and take temperature of the patient. Look for Palmer pallor, BCG scar for tuberculosis, either patient having the sign of meningeal irritation. Look changes in eyes, mouth for pharyngitis, and hard palate for petechiae. Check abdomen for hepatosplenomegaly, both for tuberculosis and infectious mononucleosis. Chest for effusion. Do genitalia examination with consent. Check legs for any chronic ulcer as it can be present due to the decrease ANC, acute neutrophil count. Check back for any bone marrow mark. Then cover the patient and say thanks to the patient. Now give brief and comprehensive description like a 10-year-old thin lean boy quite cooperating during my examination, having height of 120 centimeter and weight of 20 kg, which seem to be less than standard growth parameters. Why I want to plot on the centile charts. A large swelling on the right side of the neck was observed, 7 into 6 centimeter, non-tender, solitary, irregular and non-adherent to overlying skin or underlying structure. Adjacent lymph nodes are palpable, particularly in submandibular and submental region. The largest one is 2 into 1 centimeter, rubbery inconsistency, movable without any active sign of inflammation. Rest of examination is normal in the form of no petechiae or bruises. Hepatosplenomegaly are significant chest finding. Throat examination is normal with fair hygiene. On the basis of my examination, my differential are lymphoma, tuberculosis, infectious mononucleosis. Now give just name of the investigation like blood complete picture, peripheral film and ESR. The second one is serum LDH and uric acid level, monospot test for heterophil antibody, sputum AFB, lymph node biopsy, chest X-ray, and CT scan chest and head. Now, explain if examiner want to ask about any investigation like in complete blood picture we will see the normocytic normochromic anemia with increased ES in case of tuberculosis, while cell morphology can be seen in case of lymphoma, while LDH and uric acid level will be increased and it will show the increased turnover in case of malignancy. Monospot test for heterophil antibody would be positive in case of infectious mononucleosis. Sputum AFB will show the organism and this will be the later on culture can be the perform. Lymph node biopsy for histopathology, chest x-ray for involvement of the other lymph node and for tuberculosis. CT scan chest and head for the extension of the disease.